welcome back to a new video. In today's video, I will be talking about autism spectrum disorder briefly. The purpose of this presentation is to raise awareness about autism. If you think that your child or another child that you know might have autism, please contact a psychologist for a diagnosis. So, what is autism? Autism, or Autism Spectrum Disorder, or ASD for short, is a neurodevelopmental disorder. People with ASD have social and communication difficulties, including difficulties with social and emotional reciprocity, difficulties with nonverbal communication, difficulties forming and maintaining friendships and relationships, and some have abnormal eye contact and body language. These symptoms appear across settings. ASD has 3 levels: mild, moderate, and severe. The reason why autism is a spectrum disorder is that even among those with mild autism, for example, the symptoms are manifested differently. Autism is something the child is born with. In other words, one cannot get it after birth. We usually start noticing the symptoms in early childhood, in children as young as 1, or even in toddlerhood, and it persists into adolescence and adulthood. Even though there is no cure for autism, however, these symptoms do get better with proper therapy and support. The symptoms vary from one child to another. The child may appear disinterested in others, may avoid eye contact, may not engage in pretend play or engage in very primitive forms of pretend play, may line up toys, may use only parts of toys when playing, may appear deaf, may rock back and forth, and may overreact when touched, as these people often have sensory processing difficulties, meaning that anything that triggers their senses might be overfelt. In this case, we are talking about hypersensitivity, and some others might not be triggered at all. In that case, it is called hyposensitivity. Some red flags for autism that we see in children include rare eye contact, no social smile by 6 months of age, no babbling by 12 months, no response to name being called by 12 months, no single words by 16 months, and no meaningful 2-word phrases by 24 months. So what causes autism? Research suggests that there are probably many factors that make a child more likely to have autism, including genetic factors and environmental factors, as in during pregnancy. Genetics are involved in the vast majority of cases. In other words, autism runs in families. Parents who have a child with autism have 2 to 18% chance of having a second child who also has autism. Also, there is absolutely no evidence suggesting that childhood vaccines increase the risk of ASD. It is also important to highlight that bad parenting, abuse, neglect, socioeconomic group, ethnic background, or spending long hours in front of the TV or iPad do not cause ASD, as the child is born with autism, as previously mentioned. 31% of children with autism have an intellectual disability, meaning that their IQ is below 70. 25% are in the borderline range, meaning that their IQ is between 71 and 85. And 44% have an IQ score in the average to above average range, meaning that their IQ is above 85. As we previously mentioned, autism does not have a cure, rather treatments. Therefore, early intervention is key, as it can help in improving learning, communication, and social skills, as well as underlying brain development. Applied behavior analysis and therapies based on its principles are the most commonly used behavioral interventions for autism. They are evidence-based and supported by a lot of research. Most children with autism also benefit from other interventions such as speech therapy, occupational therapy, and physical therapy. It is important to mention that each child is unique, so one method that works with one child might not necessarily work for another child. Before concluding, I want to stress on the following important point. Just because people with autism may struggle with social skills does not mean they don't want friends, and just because they may struggle with being touched does not mean they don't want to be hugged. People with ASD are often subject to stigma and discrimination, including unjust deprivation of healthcare, education, and opportunities to participate and engage in their communities. More than half of young adults with autism remain unemployed, and nearly half of 25-year-olds with autism have never held a paying job, even though they are often capable of having jobs with the necessary and right support and accommodations. Once more, the purpose of this video is to raise awareness about autism. If you are having doubts about your child or another child that you know, please do not hesitate to contact the psychologist.